These are unprecedented times, and in order to protect the health and safety of Hawaii's people, I, along with the county mayors, have had to take drastic measures to stop the spread of COVID-19 in our community. But more must be done. I will be signing an emergency proclamation that will impose a mandatory 14-day self-quarantine on all inter-island travel, effective midnight Wednesday, April 1st, through April 30th. Those identified as essential workers will be allowed to engage in travel for essential business and operations. Yesterday, I signed an executive order that will temporarily suspend select state laws for the purpose of enabling us and the counties to better respond to the community needs resulting from the impact of COVID-19. Some of the items address Hawaii's physician shortage and the toll that COVID-19 may have on Hawaii's healthcare professionals. We will allow out-of-state physicians and nurses to practice in Hawaii, provided that they are currently authorized to do so in another state. Another directive will provide for the increased use of telehealth services. We will also increase the availability of child care services by temporarily waiving some administrative licensing rules. And we know that many of you have lost jobs or been furloughed due to this crisis. This order will help to ensure that the Department of Labor and Industrial Relations has the flexibility to provide payments to those unemployed workers in a timely manner. I am also announcing a postponement of payments for direct on-bill loans for more than 300 individuals who have received energy assistance loans through the Hawaii Green Infrastructure Authority, or GEMS. On the federal level, we have been working very closely with our congressional delegation to determine how the $2 trillion stimulus package will help our community. The measure is called the Coronavirus Aid, Relief, and Economic Security Act, or CARES for short. This is the largest emergency aid package in U.S. history and will provide help to Hawaii's residents impacted by the pandemic.
Aloha, everybody. The governor has given me a good marker allocation in my budget, so we are going to dig into some details today. Thank you, Gov. No, I'm very grateful to be here. Thank you, and it's terrific to be able to give an update on the health considerations of what we're facing today. So I'm going to allude to some of the points here. I hope people can see them. Now, the governor made an excellent decision that will save many, many lives, and you can see that over there on the 26th. That is the 26th of this month. That's that purple line that went up, where he asked us all to shelter in place and brought the hammer down on flights that were otherwise infecting our people coming back infected. That is going to save lives because it's going to definitely decrease the curve, the height of the curve of people that are getting infected. If you look at these numbers, and I know it may be challenging for a moment, we'll try to flash over there, you will see that on the 26th we had 95 cases, the 27th to 120, the 28th 151, the 29th 175, and today 204 cases, of which 6 of those individuals are in the intensive care unit. If we do a very good job, per the recommendations of Congressman Case, of Senator Schatz, of the governor, who has been very smart to decrease travel into our state, we will see this red curve, which is the projected number of tests, and that's about if we're perfect. If we are not perfect, in our ability to social distance and to stay at home, you will see a curve that looks like this purple line up above. That is if people ignore the home quarantine. And now I want to show you something important. This is how fast it goes bad for us, how fast it goes bad. If people don't listen, it will go up, and there will be 8% more cases in 2 days. 4 days later, you will see a 15% gap, 15% more cases. And then on the 6th day, if we continue to avoid good advice from the governor, you could see 43% more cases. And those 43% more cases represent hundreds of people that will test positive for COVID-19, and they themselves will spread. That is how we lose. That's how people die in the state of Hawaii. That's why the governor was so smart to ensure that we stay at home. And that's why we should listen to General Hara when he says, please, please, please follow the rules, quarantine at home. Now, I want to go over some of the other key issues here. Capacity in our state. Also on this board is the number of beds we have. We have 2,757 beds available to us statewide, licensed hospital beds. We have 338 ICU beds. We have 534 ventilators available. Now, this is important information because if you see how fast this can go up if we ignore the governor and the general's advice to quarantine at home, home isolate, we outstrip our capacity to care for people. There is good news. As of right now, and I'm going to point it over my once again, we are using only 37% of our ICU beds. That's very good news because that gives us some capacity to care for people if we get a surge. We're using 58 out of our 534 ventilators right now. 58, that's just 11%. That means we are keeping it down. However, if we do not quarantine at home, those numbers go up very fast. And just 400 or 500 people needing a ventilator will exceed our capacity to keep people alive. Now that brings us to something else important. The extraordinary work of engineers like our governor. We have already begun work here at UH, leading the country, working with technical experts, engineers in California, New York, across the country, to look at some ways to expand our ventilator capacity. There's already work to potentially make each of our ventilators capable of splitting into 4 ventilators. Now, this technology is happening very fast. It's happening with graduate students and PhDs across the country. This is the kind of thing that could rescue places like New York, who are in deep trouble, and us if we ignore Governor Ige and General Hara and people go out and spread this disease. Do not do that. But there are other technologies too. We're preparing a special kind of mask that's like a CPAP machine that provides oxygen for people in a dense. We're experimenting on that in Italy. There's another device that we're working on which gives compressions to provide air into people's lungs if we're in crisis and we have 2 beds. All of these technologies are happening in real time. We're capable of beating this. The last thing I would say is that the general is working very hard to make sure if we see a terrible surge towards the end of April or into May, if we see that terrible surge, we may have capacity to expand very significantly our number of beds. And that was mentioned by a governor at the last press conference. So we're looking at all the options, perhaps 100 or 300 or even more beds to help take care of our sick. But let me be clear. The very best thing you can do in the state of Hawaii as a citizen to save the lives of our kupuna is to please stay at home and listen to what the governor asked us to do through April 30th. Only go out when you absolutely need to, because if our curve flattens like you're seeing, we will not outreach and outstrip our capacity to take care of people on ventilators. We will be able to get out of this alive. I want to say once again, thank you very much. There's a lot of data there, I know, but I wanted to make sure people knew that we were working on the testing side. We can test now up to 1,500 people a day. We've now tested 3rd highest rate in the nation, and we're beginning to approximate South Korea. We're looking at technology to save lives, and we will expand our healthcare capacity as needed. You've heard about the bigger picture long-term on economics. We're very lucky to have the excellent congressional delegation we have. Keep the faith. Please listen to the governor. Stay home till the 30th, and we'll get through this. Take care.